Have you ever noticed waking up around 3 a.m. fully alert, even when you feel like you should still be sleeping? You're not alone. Many older adults experience this pattern, and it's not random. It's not a sign that something is wrong. Instead, it can be a natural reflection of how your body and mind change over time. In this video, we'll explore 5 key reasons why early morning wake-ups happen and what they may be quietly telling you about your well-being. By understanding these factors, you can approach your sleep with more insight, compassion, and practical steps that may improve your rest and comfort. Reason 1. Reduce melatonin production. One of the most common reasons older adults wake around 3 a.m. is the natural decline in melatonin, the hormone that helps regulate sleep-wake cycles. Melatonin production is usually strongest in younger years, allowing long, uninterrupted periods of sleep. Over time, the body gradually produces less of it, which can make it easier to wake up during the early hours. This change doesn't mean you're doing something wrong. It's simply a chemical shift that happens naturally with age. Even small environmental factors, like a street lamp outside your window, a clock's blinking light, or a hallway light under the door, can suppress melatonin and make waking up in the middle of the night more likely. Take Harold, a 72-year-old who had always been a sound sleeper. Lately, he found himself awake around 3:15 a.m., alert but calm. Understanding that this wasn't a failure, but a normal change helped him approach his sleep differently. He darkened his bedroom, avoided screens an hour before bed, and added a brief evening walk. These small adjustments help reinforce his natural circadian rhythm, making early morning wake-ups more manageable. Harvard Health notes that creating a dark, quiet sleep environment and maintaining consistent sleep habits can support melatonin production, helping older adults remain in deeper sleep longer. Harvard Health Publishing, 2023. Reason 2. Shifted sleep cycle and advanced sleep phase. Another factor is a natural shift in the body's internal clock, often called advanced sleep phase. As we age, circadian rhythms tend to move forward. This means feeling sleepy earlier in the evening and waking earlier in the morning, sometimes even before sunrise. This shift isn't harmful. It's a normal part of aging biology. If your schedule previously aligned with later nights, you may now find yourself nodding off during evening TV or waking up without an alarm around 3 a.m. Even quieter household environments can amplify these signals, as fewer distractions allow your internal clock to operate without interference. Charles, 68, noticed he consistently woke at 3 a.m. after retiring. By adjusting his evening habits, reading with warm light, taking a gentle walk after dinner, and occasionally calling his daughter before bed, he nudged his sleep window slightly later. These subtle cues help him feel more aligned with his ideal wake-up time. The National Institute on Aging explains that circadian shifts are a common part of aging, and incorporating light exposure and evening routines can help older adults adjust their sleep timing naturally. Reason 3. Physical discomfort and health-related interruptions. Physical changes also contribute to early morning wake-ups. As we age, chronic conditions, joint stiffness, or even subtle aches can surface during the night. A slight twinge in the back, nighttime acid reflux, or muscle cramps may gently interrupt sleep without causing distress, but enough to wake you. Another factor is increased bladder sensitivity. Many older adults find the urge to urinate more frequent at night, even if it's not noticeable during the day. Medications for blood pressure, heart health, or pain management may also influence sleep by affecting hydration or body temperature. Eleanor, 76, noticed waking consistently around 3:30 a.m. After consulting her doctor, she learned that a medication was affecting her hydration levels. With minor adjustments and lifestyle changes, she experienced fewer interruptions and returned to sleep more easily. Cleveland Clinic notes that subtle health changes in medication timing can influence sleep quality, And being aware of these factors allows older adults to make practical adjustments to improve rest. Reason 4. Lifestyle habits that shift sleep rhythm. Long-standing routines and daily habits play a significant role in sleep timing. Early dinners, reduced daytime activity, or limited social interaction can subtly shift your internal rhythm. Over time, these habits can lead the body to begin its rest period earlier, naturally resulting in wake-ups around 3 a.m. Caffeine timing, afternoon naps, or early evening relaxation routines may also influence when the body completes its sleep cycle. Small adjustments, such as short afternoon walks, reading in brighter light during the evening, or limiting late-day naps, can gently help the body maintain a more aligned sleep window. Walter, 74, experienced this gradual shift. He noticed early evening relaxation, early dinners, and less structured activity resulted in waking before sunrise. By slightly modifying his routines, he encouraged a sleep rhythm that better fit his desired wake-up time. Harvard Medical School recommends maintaining structured daily routines, balanced activity, and thoughtful meal timing as ways to support consistent sleep patterns in older adults. Reason 5. Emotional and psychological restlessness. Finally, mental and emotional factors can influence early morning wake-ups. As daily life slows with age, quiet hours allow reflective thoughts, memories, and subtle emotional experiences to surface. This type of restlessness isn't anxiety. It's a softer, reflective awareness. Loneliness or changes in social patterns can also play a role. Reduced daytime social interaction may leave emotional space for reflection at night, naturally prompting wakefulness in the early hours. Gloria, 80, found that journaling briefly upon waking and incorporating gentle evening rituals, like listening to soft music or sending a note to a friend, helped her manage this reflective alertness. These practices didn't stop wake-ups entirely, but allowed her to return to sleep more peacefully while honoring her emotions. The American Psychological Association emphasizes that these reflective moments can be opportunities to acknowledge feelings and support emotional well-being, which indirectly supports sleep quality. Closing thoughts. Understanding why you wake around 3 a.m. can shift your perspective. These early morning hours are not a problem to fix, but signals to understand. Whether it's natural hormonal changes, circadian rhythm shifts, physical sensations, lifestyle patterns, or emotional reflection, each factor highlights how your body and mind are still active, responsive, and adapting. Small adjustments, like a consistent evening routine, dim lighting, light evening activity, or reflective journaling, can make wake-ups more manageable and your sleep more restorative. Observing and responding to these signals with care can improve comfort, support well-being, and foster a compassionate connection to your own rhythms. You're not alone in this experience. By understanding your body and mind, you can approach early morning wake-ups with curiosity and gentle strategies rather than frustration. These insights are not about fixing something broken. They're about supporting yourself to rest more intentionally, peacefully, and comfortably.